Okay, I'm going to be doing a full abdominal assessment. I have already introduced myself to the patient, explained to her exactly what we're going to be doing today. I've washed my hands, made sure that they're nice and warm before touching the patient. I've also gathered all of my subjective data as far as abdominal history, bowel movements, and the patient has no abdominal pain or tenderness at this time. First thing I'm going to do is I'm going to check the patient's abdomen, the contour, the symmetry. I'm going to make sure that there's nothing that makes her abdomen look asymmetrical. I'm looking at the skin. I'm looking for any lesions, any incisions, scars, wounds, stretch marks, anything like that. You can also, whenever you look at the contour and the symmetry, you can check for the aortic pulsations in the abdomen. And so next I'm going to move on to the auscultating part. And you want to auscultate in all 4 quadrants of the abdomen. Normal bowel sounds are going to be 5 to 30 sounds, high-pitched gurgling sounds, within a minute. If you feel like your patient has absent bowel sounds, you do have to listen for a full 5 minutes in order to call them completely absent. So I'm going to start in her right lower quadrant, and I'm going to go clockwise. I'm also listening for vascular sounds from the aortic artery, the renal arteries, the iliac arteries, and her femoral arteries. You want to listen for any bruits, any swishing sounds in those arteries that can sometimes accompany your hypertensive patients. And I don't hear anything like that. And she has normal bowel sounds. So now we're going to move on to palpation. I'm going to be using light palpation first. And you're just going about 2 centimeters deep. You're palpating for any masses, any tenderness. Does that hurt?
No.
You're going to make sure that you're looking at your patient's face while you're doing this, just to make sure that they're really not experiencing any discomfort. So once you've done that and everything feels normal, you're going to move on to deep palpation. That's about 5 to 8 centimeters. And for that, you're just checking the location and the consistency of organs. And again, palpating for any masses or tenderness or anything like that. She feels good. Does that feel okay?
Mm-hmm.
Okay. We're going to palpate the liver and the spleen and the right kidneys and the right kidney and the left kidney. You should not be able to palpate any of those. So I'm just going to put my left hand under her side and try to palpate for that right kidney, which I don't feel, and the left kidney, which I don't feel. I'm going to start right here at the umbilicus for the liver, and I'm just going to kind of go in an up and down motion. You may bump into the edge of the liver, but chances are you're not going to unless the liver is enlarged. The liver lives under the right side of the rib cage. Okay, I'm going to have you turn on your side, and I'm just going to put my right hand here and my left hand right under her left rib cage, and I'm going to palpate for her spleen, which I don't feel. Okay. The spleen has to be 3 times the size, its normal size, for you to be able to palpate it. Next, we're going to move on to percussion. I'm going to percuss in all 4 quadrants. And when you percuss the abdomen, you're going to feel mostly tympanic sounds, because with the patient lying back like this, you are going to have all the gas and air come up to the top of the abdomen and make those tympanic sounds. You're going to hear dull sounds over organs, and her abdomen is nice and tympanic. You can palpate for enlargement of the spleen by percussing as well. Sorry, I'm going to have to turn one more time. You're going to place your finger at the lowest spot on her ribs, about the 12th intercostal space on her left side, and you're just going to, again, percuss, and you should hear tympanic sounds. If it's dull, that means that spleen has come out from under the left side of the ribs and could be enlarged. You can also percuss for the size of the liver. You're going to start up at about the 5th intercostal space. And for the anterior part of the liver, you're going to percuss from the top down, and for the inferior part, you're going to percuss from the bottom up. So what I'm listening for is a change in tympanic to dull. Okay, put your finger right there for me. Perfect. And I'm going to start right here. And the normal liver size should be 6 to 12 centimeters. So I'm just going to measure from top to bottom. And hers is about 7.5 centimeters. So hers is good. In conclusion of this abdominal assessment, there were no abnormalities noted for the patient. Therefore, patient has a normal gastrointestinal assessment.